Shannon Gilmartin, a certified massage therapist, is a co-founder owner of Modern Cupping Therapy Education Company, a licensed and nationally certified massage therapist, certified modern cupping therapy practitioner and educator, and certified manual lymph drainage practitioner. In addition to her focus in therapeutic cupping, she's over 20 years of experience in bodywork, including manual lymph drainage, medical massage, myofascial release, neuromuscular, craniosacral, soft tissue injury rehab, Thai massage, and visceral manipulation. She's taught all over the United States and abroad, including Canada, Costa Rica, Guatemala, Ireland, Italy, and Puerto Rico. Shannon owns a private practice in Virginia Beach. She's also authored The Guide to Modern Cupping Therapy, which has been published in Massage Magazine and Massage Today. She's done online interviews with Bodywork Buddy, The Juice Guru, and The Donna Sibo Show, and lectured at sports medicine conferences and hosted live webinars with Lhasa OMS and Camwo Herbs. Shannon is also very passionate about her work with charitable organizations, including Global Healthworks Foundation, Homes of Hope Orphanage System, and Surfers Healing. Modern Cupping Therapy Education Company is nationally recognized as a continuing education provider in the United States and Canada. So welcome, Shannon. I will pass this over to you.
Thank you for having me, Celine. Always a pleasure to work with you. It's always funny hearing your own introduction, but I love it. So when you invited me to do this presentation tonight, it was an interesting shift, which I was excited to do, that changed from education and information to simply talking about a client history, which we all have many. And over 20 years of body work, I could talk about so many, but this one in particular, as a young practitioner, really did change everything for me, hence the title of this evening's presentation. So I'm going to go ahead and share the screen and start with what we're talking about here. So let me know that you can see where we are, making sure that everything's okay. All right. So hopefully, Celine, do you see everything clear? Yeah. Okay. Yeah, you're muted. Okay. I got it. Thank you. All right. So starting off this adventure with the cupping world, ultimately, it's fun just to give a little bit of a background about myself, like Celine said, so I don't have to repeat too much, but I began my adventures in bodywork in 1999. I have a variety of bodywork that I employ. I am very well known for the post-surgical and clinical applications, orthopedic pain management. But as she said, I have a wide berth of various applications I employ. I was asked in 2017 to write my first book. And originally I was like, I'm not a writer, I'm a teacher, I'm a body worker. And now I am very happy to say I have 3 books out and there's more to come. And a long story short, I love cups, and hence the starting of this evening's presentation. So let's go through this. So my presentation details, I'm going to talk about one client in particular that I met very young in my career. And to get us into that, I'm going to give you a brief overview of cupping, regardless of your background, whether you know a lot about cups or barely at all. I'm going to give you a little overview of how I teach the company that I now run, and then some of the benefits, especially as they relate to scars. But then we're going to dive into scar tissue itself, my experience with cups and scars, and ultimately we'll spend most of the time talking about this amazing client, her story, and how it did literally change everything for me. So to get started, cups are honestly some amazing tools that everything based in my education platform comes from research and 20 years of clinically applying cups on people. But everything that I've come across through articles, paperwork, and other people in the field, the general physiological responses from cups and these mechanisms of actions, for another term, are the negative pressure, the vasodilation, and enhanced fluid exchange. So without having to go into too much detail about those, think about cups as we start talking about scars, how they lift tissue and they pull on the body, and how all these fluids start to make changes in soft tissue because of the vasodilating reaction and the fluids that move in the spaces between thereafter. So one of my major goals in education is to teach people all of the potential available from cupping. And when you put those three mechanisms of actions together on the body, we have a lot of opportunity for changes and therapeutic reactions. So here is a basic list. Well, here's a pretty detailed list, but I won't go over thoroughly. But to understand how cups affect the body, they're encouraging circulation. They alleviate adhesions or restrictions. And so tissues that are stuck that shouldn't naturally be so are defined as that, adhesions. And when we get into scars, it's really gonna hopefully paint a picture. They help clear congestion and stagnation, potentially releasing interstitial debris, which is going to be very obvious. Lift, rehydrate, manipulate fascia. We are fascia creatures from our skin to our bone. And so depending on the scars we're working with, it really can be a dramatic change. Things like inflammation can still be involved with scar tissue, I'll get into in a minute, causing micro trauma in tissues, not tissue damage. The biggest misconception with cupping that I always advocate in my classes is that they're not macro traumas. And so there is a fine line, and there is research to support both sides of the argument that cups are not bruises. They are micro traumas, which can cause vascular damage. And so we can talk about how we're going to break down some scar tissue to create healthier tissue in its space. And so there are some people who will argue that they are bruises. And of course, there's a physical reaction that happens in the body. But the biggest difference with bruises that we always tell people is that bruises are painful and from traumatic treatments, whether it's positive pressure or negative pressure of a cup. Encourages neovascularization. That has a lot to do with a natural phenomena of capillary regeneration, also known as angiogenesis. And during scar formation, that's a very active process and sometimes be inhibited. And lastly, alleviates excessive pressure on sensory organs in the skin, soft tissue, which leads to reduction in pain. If you know people with long-term scar tissue, they can have scar pain that lasts as long as they have the scars. So let's talk about scar tissue formation. So scars generally have 4 phases of formation, transformation, and it's important to understand how that process happens when you get into understanding this client I'm going to talk about. The simplest and quickest stage is the hemostasis, is when it has that emergency healing phase. Then quickly thereafter is the inflammation phase, which the body starts to, create the inflammatory processes to heal the site of injury. And when scars happen from a surgery, that is a necessary part of the healing process. Inflammation generally is. Then there's a longer phase that we have to transition into called the proliferation stage, which is when the thicker collagen 3 fibers are formed. This is when the cutaneous innervation becomes active. This is when the neovascularization takes place. This is when it's very important to care for scars and, if possible, support them towards a healthier remodeling phase, which lasts a really long time. Some surgeons will say remodeling phases last about a year. So it's from this time of surgery to that 1 calendar year that you'll have your normal state. And some surgeons might even say it could be 2 years that those thicker collagen fibers start to reintegrate and become more uniform in formation. And people should expect ultimately their normal phase, their normal bodies after about a year from surgery, okay? So that's important to understand as we move forward. So my history, I always share a bunch of my personal aspect with scars with my students because it made me the teacher I am today because of my experiences on my level with scar tissue. So when I was a kid, I had a major motor vehicle accident that left me with a very large scar on the left side of my face, which to this day people have a hard time seeing, but I'm very proud of the cupping work I've done to get me here. And I supported the healing process. I had a lot of unilateral pain from the car accident. It was a total impact injury and lacerations. A couple years went by of just total discomfort. And after that 1 calendar year, my face was something that, a late teenage girl would probably not enjoy spending the rest of her life having, but I'm alive and grateful. But I did become a massage therapist because of a therapeutic treatment I had that gave me some interesting soft tissue pain relief. And so that created the massage therapist I am, right? When I went to school for massage therapy thereafter, because I wanted to help people, right? Because I was gifted that by a massage therapist. So then that started my training, and I wanted to pay it forward and help people because I thought it was amazing. So then, as a massage therapist, we have to do our continuing education hours. And I went to my first cupping class, which was awesomely weird. And, you practice and exchange in most of these classes. And it was very interesting, the sensations I had, and it was hard to describe them, but I was hungry to learn more. And with that eagerness, I eventually became a teacher. And with that teaching ability, I felt like the doors opened for research and practice, and to make myself the best teacher I can be, I am always in the research and development aspects. And so with that came not only the practice on my family and my friends, but then when I incorporated it into my business, because I don't practice on clients, I definitely worked on my personal self-care. And so when I started doing the cups over my areas of soft tissue injury, and especially when I started working with my face, that was the game changer. And I remember, so I'm from Massachusetts and I moved to Virginia where I live now, went to school and went back to Massachusetts just to, revisit family. And I decided to come back to Virginia after 5 years. My massage therapy teacher looked at me and was just blown away with how my face had changed because I was using the cups to kind of futz around, for lack of a better term. And I was learning about lymph drainage and just trying to put some pieces of a puzzle together that weren't totally making sense, but I was having such good results that my teacher, who had this client we'll talk about, ultimately said, I've been doing amazing scar tissue work, and we learn scar tissue manipulations with our hands that are amazing, and I will never take that away. However, my teacher was doing such amazing scar tissue for this person that ultimately, when she saw my face and heard my enthusiasm and what I had been doing, she's like, I'm going to send you this client. So we're going to talk about her. And I have the permission. My client has come to some local classes, and this is I love sharing this. So here we go. So if you talk about a body lift scar, some people are or are not familiar with what this involves. And I will give you the history of my client in a few moments. But generally, when you hear about a body lift, there are different sections of the body that can be augmented, altered, surgically enhanced, changed. It's removing skin that's loose. And so in these images that are from various plastic surgeon sites, just to show you what would be involved, in the upper left corner is a picture of abdominal sections. There is one across the belt and one straight up. It's called fleur-de-lis. There's breast tissue scar lines and tissue removal when they want to be reconstructed because of loose tissue. Those are not shown. I have gluteal regions and hips, and there are many different directions that those procedures can cut the body depending on what the goal of the procedure is. And then we have down through the legs, there's usually those inner thigh and vaginal region areas that can be involved. And then the upper arms and axillary spaces to help remove the skin that is loose in those regions. As we begin to talk about my client, she had all of this and more. So my dear client, when she came to me, I remember her walking into my office, and I'm excited and nervous every time I meet a new client because I want to do the best for someone I can. And I know that body work is so widely varying. So when this person comes in, she had a very awkward gait. She had a very just not positive demeanor. And she was coming in because my massage therapy teacher said, I'm sending you to this girl, Shannon. She's doing this stuff for scar tissue. Go see her. Now, my teacher was doing some very wonderful scar tissue treatment for her, but it was painful. It was very positive pressure, right? Pushing to break up with different fibrous cross fiber friction, circular friction, stretching, fascial releases, all this pressing into a body that's already tight. So my client in 1995 had a gastric bypass surgery. And so with that, she had rapid weight loss, and that resulted in her dramatic loose skin. And so, the thing about modern day cosmetic surgeries and any surgery really, they are progressing with time and getting better, and more quality is evolving. And, I've been in body work for over 20 years, and I've seen quite an impressive shift. So I could have told you all stories about other negative experiences, but this one really resonated and changed my career and lots of my life. When I met her and on my intake form, there was so much to discuss. We sat and talked for half an hour because she shared with me the trauma of her surgery. Beyond the healing process of her skin, she was literally cut from her elbows for that arm lift, through her armpits, under her breast tissue, straight down that midline, through the groin space, around the gluteals, across parts of her hip, her low back, and into the center of both knees, which just this past 2 years, she had to eventually get knee replacements because those scars pulled on her joints so bad. From the minute I met her, she was always having dysfunction. But she was telling me just such a sad story of her experiences. So her scars that had to recover, her emotions that were recovering, because there's so much emotion that comes with a surgery like that, right? And ultimately, she had a very negative experience. And there were some issues with the practice, and she has, been compensated for the trauma, but her body is as it is. And so when we met, she had already in 1998, 2 years after her surgery, after she had recovered, started getting scar tissue therapies from my teacher. And so remember, 5 years after I went to massage school in 99, left and came back, my teacher saw me, saw my face, and that's when we got to work with the cupping and the scar tissue. But I was very new to the practice. I knew that less was more, and I knew I didn't want to hurt someone. So I was excited and nervous at the same time. I always go back to that because I think that makes me more focused. And so here we'll go in. My initial treatment to work with her, because she was complaining of the poor circulation, her bowel dysfunctions were really, she had major bowel dysfunction, general lethargy. Sorry, that was in the previous screen, talking about the poor circulation. She was acquiring a lot of vascular issues she didn't have before surgery, varicose veins. Her range of motion was limited because the scars were so locked into the underlying anatomy. She had chronic pain all over her body. And obviously that would result in a lot of stress. Okay. So I didn't want to glaze over those points because those will come through as we progress. So my first appointment, I was, like I said, a little overwhelmed, and I knew that circulation was kind of like the way into her body, and we would figure this out together. And when she came to work with me, my goal, and I told her this, I said, I'm going to use this the best I can, but I don't want to do too much. So my goal is going to be using cups to move lymph around your body with the basic routine that I learned in massage therapy school. Okay. We know that we move blood around. We know the lymph has its own circuitry and flow throughout the body. So I was going to use the cups to follow that in a very basic manner. I was also, because her abdomen, she was really uncomfortable. The scars through her midsection were obviously contributing to general gastrointestinal dysfunction. And she complained, it was a very infrequent, her bowel movements, and it was always painful. So I was going to follow around the colon tract with the cups because I knew that they could affect peristalsis and stimulate the muscle contractions to help her with movements. And then I was going to start using the cups over every inch of those scars. I was going to figure it out. And I was honest with her. And she said, listen, I don't think you're going to hurt me. I'm game. My teacher spoke highly of me. She's in, because she wanted any chance to have a change. So I did just that. It took us about an hour to slowly do it. But it didn't go too slow. I just want to kind of introduce it. After the session, she reported really not feeling much of anything, and she was relaxed. And I said, well, that's great. I said, give me feedback the next day. And I always encourage that. Every single new client and every student I teach, I said, when you start with this, less is more, get that feedback and that will help you strategize. So the next day, my client says she wasn't sure, but she felt different and she had a wonderful bowel movement. And so, that got me excited. And I said, well, listen, you've had these scars for so long. You've had this discomfort in your body. If you want, let's figure this out together. And she was totally eager. So my plan, I mean, it was everything. I was using cups along the drainage pathways and the digestive tract and the scar areas, just like I did. But then I started adding more detailed techniques, sometimes stationary, right? Sometimes moving, and then all these other techniques that I was like formulating and writing things down and noting. I started doing massage therapy with the cups, so I couldn't use cups too much because of what they evoke in the body. So I was blending things. I started stretching her with and without cups, resistance, everything. It was amazing. So what you see here is, now mind you, way back when we weren't really taking pictures of everything. And she didn't want me to take pictures because she was very, self-conscious, rightfully so. So as I started taking pictures, I said, listen, I'm having these amazing cupping marks. Do you mind if I take a picture? She says, not at all, just not of, certain body parts and definitely not my face. So after about a month of working with her, we were steadily increasing suction pressure, length of time, and building, not overwhelming her body, constantly feeling positive results, nothing overwhelming, no healing crisis, no nothing. Cupping marks started coming up and they were dramatic. If you see this image on the screen and you see that, my favorite part is the impression of the cup, yet only cupping mark through the line of her scar, some red speckling, some surrounding, but also some dark colors. Now, the way a scar forms, the underlying anatomy also plays a role in locking into those thicker collagen fibers that sometimes don't shift out of that proliferation phase into the remodeling successfully. So she had really deep muscle restrictions under the scars. So that's where you see some of that surrounding speckling to the tissue. But as we started working, everything changed. These cupping marks started happening. Her bowel movements becoming more frequently and comfortable and greater and regular, right? We all love that regularity. Her skin color started to improving. Her skin even started to readhere when it was still kind of loose and flaccid because all those cuts through the skin were inhibiting that tonicity that the surgery was for in the first place. So things were toning, her range of motion was increasing, her mobility was improving, her pains were diminishing, and her energy levels, she started brightening. So all of this is happening in the first 3 months. We planned on once a week, and she lives an hour away from me. Well, did then and still does now. So it was a lot of commitment for her to come in. Now, as we go through these pictures, these are dramatic. And so when I teach my class, I do have some more that I show, but I didn't want to overwhelm you guys if you're not familiar, and they can be a little bit off-putting. After about 3 months, first one, I thought it was an ingrown hair, but there was never a hair there before. A suture came to the surface. I don't extract because that's not my profession, but her husband did. And she still has them now, several in a container because they started coming out. And if you think about the negative pressure that cups take effect on the body with, it's a vacuum to help pull things literally out of the body. In this whole process, there was no pain of cupping marks, no pain of deep tissue massage. We were working in together, realizing where she was comfortable, where she wasn't. These dark colors were coming out. You can see in the right image, even the impression around that one, how much is stuck in her soft tissue for all those years before I met her. The one thing you're not seeing in these images, when we first met, all of the scars were dented inwards. So atrophic scars are your normal ones that are even with the skin surface or slightly sunken in, not hypertrophics or keloids. These were all dented in, restricting her range of motion. Over our time together, they are all flat on the surface, yet because of the thicker collagen fibers that were there so long, still inhibiting circulation and healthy tissue function. So as we're working, these colors coming out did not scare either one of us. She was like, wow, look at that. She was elated because she felt the changes. She was experiencing this positivity. Everything improved from her skin to her muscles, to her range of motion, her bowel dysfunctions, and ultimately those scars looked beautiful, absolutely beautiful. So I still see her today. these images I took, what you see here, the ones with the cupping marks still present, are from our treatment process when I started. It dawned on me that we should probably be taking pictures. So you see these really dramatic cupping marks. And as a teacher, I always have to kind of flip the switch for people that see cupping marks and think they're negative. They're bad when they're painful and done because people want cupping marks. People think that if you don't get a cupping mark, you're not getting a result. That's not true. Absolutely not. However, when you see them, they do paint a picture. And looking at my client's scars now, on the far left, you see that's actually her gluteal space. And the lower image is her a month ago. And on that middle is the posterior thigh. You can see from that posterior gluteal line down her midline of her knee. You can see that it goes, I didn't want to undrape everything, but you can see that. And I did teach her some personal self-care for the ones that were in her vaginal space, because neither of us, that wasn't a place we were going to work. And she had good results with that on her own. On the right are her posterior left triceps, upper arms, and that's where that first suture came out. And they came out of pretty much every section of her body over the years, and still to this day. And something that I glazed over when I work on my face scar, this is now 20 something years later, I still have glass and sand that come out. And the body's connective tissue is one thing that forms thickly during scar tissue formation, and it can inhibit getting that garbage out. Vacuums, cups help the body get stuff out. So her tissue, her mobility is amazing. She walks around wearing t-shirts and tank tops, which she really didn't before. So, to summarize, it's an amazing story, because ultimately, when I started working on myself, it was one thing to experience, but then being able to share that with someone and to see the transformation in her from start to now, let alone like that major change with her, was within a couple years of working with me. And, I've acquired a client for life. So it began really letting me see the power of cups, and that there's so much potential, because everything from the scar to her emotions to her digestion, like it was literally every system of the body changed with this person. And that's how I teach, letting everyone know every system of the body that is affected by cups, and how you choose to yield the cups is to your discretion and your professional interests, right? Because of how profound the change was in lymph, I've always had referrals that would send people for manual lymph drainage. I became certified. Now I am still like a level 1 certified practitioner because I have a really powerful network, but it encouraged me to become a better practitioner with lymph. And then I decided to dive into scar tissue studies, which I have a wonderful program that was formulated not just from this one client. I formed this material and we started teaching it as its own portion 7 years ago. And we're still improving it constantly, because there's always more research to come out to improve bodies of information. And so all of this ultimately made me not only the better practitioner I am and the teacher I am, but I feel like as a person. At the bottom, it says I gained a new family member. And, I'm of the mind where you have blood family and you have chosen family. And this person is definitely a close part of my life now. And I've learned that as a body worker, you have the option to do more than just check in and check out and do your work. And that what we do changes people on so many levels. And I am so grateful for this experience with her, because it made me who I am in every single aspect, personally, professionally, and just like as a human. Like that was kind of a tipping point for me. And she loves everything I tell her nowadays, of like when I go volunteer, how my classes are. Like I don't, there's that privacy as a practitioner. I don't divulge things like while I'm not saying her name, but she loves it because she knows, and I tell her, I learned so much of this with her, and I'm so grateful for that. So yeah, that's my story, guys. That's my major follow-up that started and snowballed and brings me to where I am. I teach this subject with such enthusiasm. I write about it because it is just that awesome, and I truly love cups. I can say it in so many directions. So thank you for letting me tell this story. And I hope you found it fascinating and intriguing. And whatever you do with cups, consider opening up that lens a little bit and applying cups maybe differently than you have. So thank you.
Thanks so much, Shannon. I think
Yeah.
that one of the special things about that presentation is it's not often that clients stay with one practitioner for so many years. Like it's a it's like those science labs extend for like
Yeah, I mean, I'm grateful. And like, I've been in Virginia now 16 years. Like I said, I went to school and then I left and I came back. And I mean, I still accept new clients, but I've had people for so many years, so many years. And I'm grateful because, I'm of the mind where I tell people, like, you need that regular care. And it's not even just like crisis, it's just general feel goods and maintenance. And so people stick with me and I'm honored. And like, that's how I know we have this flourishing business because we kind of have that energy in the office. So yeah, that's my thing.
Thank you.
Thank you.
Mhm.
We'll open it up to questions. If you missed any of the presentation, this has all been recorded. And the link will be sent out in a couple days once it's uploaded to our YouTube channel. But we'll see if there's any questions. Does anybody have any questions about the case, about Shannon's practice? How soon after surgery can you start cupping?
Very good question. So there are different methods of application that are dictated by the phase of healing the person's in. So typically there's indirect and direct applications of a surgical site, and there is respect of inflammation and then that proliferation phase. So, I don't want to go into too much detail because I find if I do that in this limited space that some people can do, unfortunately, not positive things. So I would say you don't want to work on or around any scar tissue until it's fully healed. Scabs, sutures, raw, open, irritated tissue. And if you ever have a question, you ask their surgeon. We have done some things within a short period of time, and typically it's a couple months before that healing phase has passed. But that proliferation phase is very specific. You don't want to inhibit that healing process because it can make thicker scars during that process.
Okay. We actually don't have a lot of questions.
Hopefully it was a fun story then.
What's the best healing oil to use with cupping?
So interesting. So with cups, it's good to use a light oil that has good viscosity, so it slides over the surface, because if you're doing movement, then you want something that moves easily. But for the scar itself, there's so many good products to apply after you've treated an area, but because cups encourage that circulation, anything you apply will be absorbed deeper. I'm a big fan of some scar massage products from the Heritage store here. They have like good camphor and thick materials. Castor oil is really nice. Vitamin E is very good for scars. But I'm of the mind where it's practitioner preference. What kind of products do you like to use for scars? Vitamin E and castor oil is really nice, and then some other particular products that are literally named for scar tissue therapy.
All right. Does anybody else have any questions? Hopefully it was just very straightforward.
I mean, I like to think that I speak a lot, so I fill in the blanks on ahead of time, so that's good.
Really appreciated the slides and from the beginning of when you started taking photos to even now, and really kind of get a sense of the treatment journey that she went through.
Yeah, it was hard for me to really put it into a slideshow simply because, like I said, we weren't taking pictures back then. This world we're in now, I mean, every client that walks in the door here, I'm like, so if we're doing something, I have it on my release form. Like if we decide what's the wording? It's like, if there is the opportunity to have photo documentation, do you give permission? And I have clients say, yeah, for sure. And others are like, absolutely not. So, and as an educator, I have a pretty impressive slideshow of images because people need to see that. And the scars that we show continuously are awesome. And I'm grateful that we get that opportunity to share that.
There's a couple of questions and I'm gonna roll them into kind of the same answer. One is, do you offer courses? Which, after the Q&A, we will talk about that. So if you wanted to stay on after the Q&A, we can go through all of the courses that Shannon has. They keep
Yeah, I
growing.
have there's 10 days now, and next year
Yeah.
there'll be 11. Yeah, I love
It's a
talking about
Shannon
cups.
marathon that we're doing. And then another question was, how long would you put cups on each scar? Which I think it's very specific, and Shannon's got a whole scar day if you wanted to come to that. But we can, so we can kind of talk about those after some of the Q&A.
Yeah, but can I answer that real
Yeah,
quick,
yeah,
just in case I don't see people in classes? I'm not the woman to say constantly come to my class. I always advocate
that's my
safety.
job.
So yeah, that's your job.
Yeah.
So the safest thing for cupping to understand is that less is more. So that to put a timestamp on it, sometimes with this client, it was 30 seconds. Sometimes with this client, it was a couple minutes. And, in this world that we live in now, as an educator, there's a constant conversation, and I say that nicely, that people say you have to leave them on for this amount of time to get the therapeutic results. That is not true, because you can have a very short amount of time and cumulative applications to get the benefit. In the United States, the NCBTMB and NCCAOM, I've had conversations with both boards. One is for massage therapy, one is for acupuncture. And neither of them say there is a law that designates the time frame, which that makes some people that do cupping happy. They're like, I'll leave them on for 20 minutes. But when I said that time frame, that some cupping practitioners are doing that, both boards without hesitation said, it's not about a timestamp, it's about common sense. So especially with scars, and there's that different healing phases and the length of time, just think about less is more. And there are cues that you shouldn't leave cups on for too long. Everything from a lot of cupping marks to circulation that's brought into the area to discomfort of the client. All of these are cues to not keep cupping. And so time stamps, lower times. You can take them off and put them back on, but just keep it safe, because cups can do damage when they're left on for too long or put on for too strong. That is a huge thing to understand.
Are there contraindications for cupping?
Oh, very many, very many. Yeah, everything from the open wound. So, I have pages of safety, contraindications, considerations that I discuss, but in a scar realm of conversation, like I said before, never over anything that has sutures, scabs, any tissue that looks like that lift of the cup would reopen something that's healing, right? Because think about that lift, and that body will make more collagen fibers, those thicker ones, if you inhibit that healing phase, and that can lead to those hypertrophic or keloid scars, which I do discuss both of those in a classroom setting, because they are very serious. They can both benefit, but one overworked can contribute to another's formation.
Have you worked on hip replacement patients, and do you need to worry about loosening the fascia too much, if that's even possible?
Yeah, so great question. So they have, there's a couple different hip replacements, both anterior and posterior. And again, it comes back to that timing. Just think about this. So without, having to sell you into the classroom, the closer you are to the site of surgery and the time of surgery, we're more concerned with supporting lymph drainage and improving general healing. I would never do the same cupping for scar tissue within the first 2 months that I would 8 months later. And there is a time frame, because a lot of the orthopedics I work with, they will send me people at that month period for the certain type of work I do with cups, rather than the orthopedic would say, hey, it's been 6 months, this person's still stuck in a not positive rehabilitative state. Go ahead and do other work with the cups to try and break down the scar tissue, rather than there's ways to use cups to help the healing process. And there's ways to use cups to break down the scar tissue that forms and isn't healing properly. I'm never worried about that fascial integrity and the connective tissue components when you're doing it with respect to the level of healing they're at.
In general, what do you recommend patients do after a cupping session that may enhance the treatment? Like drink water, rest?
Yes. So definitely drinking water, because one of the biggest things I tell people is the fact that, cups hydrate that tissue from the inside out. And so you want to replenish that. But it's also, cups are not people after any kind of body work. And I know acupuncture, it's all just keep the hydration going, keep things circulating. I definitely encourage the resting. And for me, especially with cups, because of how much we're distorting the soft tissue and the fluid levels, I definitely suggest people that they rest for a couple hours. It doesn't mean they have to lay and wait in my office. It just means not to go out and overly exert their bodies until they feel like they're back to normal. Even in my classroom setting, students want to leave my classroom and go do exercise in the gym. And every time, I mean, it's been 20 something years, every time that happens, they're like, I didn't feel as strong, or it was really tired. I'm like, let your body recover. You just distorted all the soft tissue. It has to process.
And what would be the maximum time to leave a cup on?
So my safety parameter, 1 cup in one placement maximum would be 5 minutes. I recommend 1 to 3. And there are methods of assessment to see if you can reapply the cup in that location. But there's also insight to say maybe that's just too much. So remember, I said start with low times and also start with lighter suction, right? You want to increase this slowly. And my favorite word with cupping is cumulative, because it's better to let the body welcome it and encourage this whole healing facilitation than overwhelm it. Because I cannot say enough how many times I've heard people have bad cupping experiences, and it can either turn them off entirely, or it makes me the better practitioner forget about the teacher. Because when people have bad cupping experiences, I'm like, well, what happened? They're like, oh, they were left on for like 10 minutes and it was painful and I had these bruises for like weeks. I'm like, well, I'm sorry that happened. I promise you that if you don't want marks, you won't have them. So I always say, if I promise, I'll deliver. But they feel great results with a cup without these adverse reactions from prolonged or too strong applications.
Is the 5 minutes for scars specifically or for cupping in general?
Cupping in general.
Are there any other questions from people? If not, I think I'm gonna end the recording here. But I wanted to talk a little bit about Shannon's courses and let her explain a little bit, because she is coming to Toronto. For any of you actually anywhere you can come to Toronto. So I'll stop the recording.
Okay, thank you very much, Selena. I love this opportunity. It was a very fun, different format than we've been doing it. Yeah, awesome.
Okay.
Thank you.